regards curriculum of hair transplant training with ISHR. So, dear doctors, the brief about the curriculum is first we understand the anatomy of the scalp and the hair follicle. What is non-androgenic alopecia? What is androgenic alopecia? Its pathophysiology and classifications. Then we're going to discuss the hair transplant consultation. What are the questions your patient is going to ask? What are the things you want to observe and calculate during a consultation? Like how much donor graft he has got, how much donor area needs the coverage, is he a right candidate for hair transplant, what are indications and contraindications of hair transplant, what about the hairline design in the male, in the female, beard, eyebrow, what is body hair transplant, beard hair transplant, scar hair transplant. Then we're going to discuss about hair instrumentation, the dull punches to extract hair, the sharp punches, the serrated punches, the trumpet punches, different types of punches, and the art of hair graft extraction, how to extract good quality hairs with minimum transactional damage, out of body time for the scalp grafts. Then we're going to discuss about donor management, how far you should extract. So once you've done a transplant, it should not look so thin. You should be able to repeat the hair transplant again. So there's a whole art of safe donor area and how to extract the hair. Number two, we're going to discuss about planning of the recipient area. You always are going to have less grafts than the grafts you require. So how do you plan it out? The slit making with the sapphire blade or semi-conical blade or plain blades, So we have to discuss that. What angle you're going to put the graft, what direction it's going to be, what sort of curls it has to come through, the soft hairline and the transient zone to make the hairline look natural. From glabella point to the frontal point of the hairline, how do we construct a hairline, how do we give shape to a patient's face, with the correct hairline, whether he's Asian, Caucasians, African, he's 25, 35, or 55-year old. So all these things will be discussed in detail. Then we are going to discuss about how to make the hair graft survival better, not using adrenaline over hair, not keeping the graft outside the body for long, it may die, avoiding repetitive pressures, repetitive injuries, crush injuries. So it's very important what makes a great hair transplant and what are the pitfalls one should avoid for a poor hair transplant results. Then, although it's local anesthesia procedure, but 6 to 7 hours you're giving, so it's very important that you have a safe hair transplant, aspirating every time, using local anesthesia, which is the safest possible, keeping a backup plan with a fully furnished OT with defibrillator, boils, emergency crash trolley, oxygen cylinders, all emergency equipments. So, and even a standby anesthetic. So, first of all, don't choose a case which can create a problem. And rarely, if a problem occurs, you should have a whole backup plan to handle that problem. And last, the curriculum will also include you may be the best surgeon or a dermatologist, but if you don't showcase yourself to the world, people won't know about it. So you have to document your photography, the video testimonials. You have to have good communication skills. You have to present yourself well into the world. You have to get newer techniques, better and better techniques for your patients because they want to compare you. Because after all, it's a cosmetic industry. It's not a regular disease-based medical practice. So should know how to position yourself, how to brand yourself, how to communicate yourself. And these videos showing your great work, your knowledge, your before after photographs, the video testimonials, your techniques, your skill, your expertise is equally important to be projected to the world. So, welcome to ISHR for a great learning experience with our faculty so that we do your hand holding for 1 year and help you start your hair transplant practice. Initially, whatever cases you want to do, you want to be in touch with the faculty so that you don't land into the wrong path. You should be on the correct path as the protocols train to you. So be in touch with us, get trained, and then follow us for whole 1 year till you become confident yourself to run your hair transplant practice.